Nana says Aunt Allie was a sunflower person. Sunflowers are big and bold and bright and beautiful.
We had thought over so many different things that we wished to do in memory of Alyson. There was nothing quite right until Susie presented this idea to us.
For some time, we have understood that our clients have not had access to health care that is both affordable and helps them meet their needs. Often, our clients have to travel long distances to get the help they need, so they might take 2 or 3 buses to the hospital. They might go to emergency rooms where they'll wait 2 and 3 hours to get seen by nurses or physicians. And often our clients aren't able to do that, either because they're frail or because of their cognitive functioning.
The importance of Susie's idea for this clinic is that we are obligated to have integrated care, to be a survivor in the health regime of the future.
What is so unique about this project is the dichotomy of having a major healthcare system, a major entity like university hospitals, pushing and supporting on the one hand with David Rosenberg's support, and knowing we have the backing of them, which was essential, juxtaposed against these very meaningful relationships on the other.
We were very happy to have our good and old friends participate in the collaboration of this. First of all, our neighbor, Will Sukenik, who I think greeted us at the door when we came home with Alyson. So we've known him for forever. And Tom Galvin, I've known since I was 12. And Shelley, they have been wonderful. With the design, they did the design and the layout, which is perfect. Dr. Rosenberg, who has been so wonderful. He has helped us in so many ways, telling us what we needed and what we didn't need. Wonderful. And of course, Margot and Bob Roth, old friends of ours. And we are delighted that they wish to participate in this.
I think it's great that this is away from the traditional hospital emergency room settings.
And where there's access to public transportation too. I mean, it's right near the highway and there's a bus route, and that certainly helps.
My role was to make certain that the job was done according to plans that Tom Galvin drew up, and I actually brought in Alan Pearl, who I have partnered with on various JFSA projects. I just felt the presence of Alyson as I was doing the job. I visualized a few times near the end of the job that she was looking down from up there and smiling. And I think that when the carpeting went in, during that day, I mean, the lights flickered several times. So I think she liked it.
This clinic was founded because my grandparents knew how much love Aunt Allie had to give. It is built on love, and with love, and for love.
Myrna and her family members went through JFSA and chose artwork that they felt like reflected both Alyson's spirit and the spirit that they wanted to convey at the clinic. So we've chosen artwork that will be hanging in the clinic. We think over time we'll rotate artwork throughout the clinic that our clients have created. So it has a very creative feel at the clinic, and we think conveys a lot of the vibrancy that Alyson carried with her.
She really had a spirit, I mean, a great spirit. She was always smiling. She was always seemed happy. She loved her kids, and she was just a lovely, lovely person.
She was a sweet soul, and she just was a beautiful, beautiful woman. I loved her.
The Mount Sinai Healthcare Foundation, they've been standing behind us for the last 18 months while various regulatory bodies have tried to work out the details of how primary health care works in an embedded behavioral health care agency. They were important funders. So without many other people within the community also stepping forward, it would have been very hard to do in a traditional social service environment like this.
I think it's important for people to realize that this is kind of outside the box, so to speak, for Cleveland, and how important that is, and that's the kind of thing that JFSA does that other people do not do. They try and initiate new kinds of programs to serve the underserved.
All the vulnerable people in our community will be served by this clinic. And by having integrated care, we assure that we can provide special care to everyone.
With this clinic, when our clients come to us for one need, we really hope to be able to serve all of their needs at one time. And I think they're going to get better care. And I think that's the kind of person that Alyson was. And I think that's what she believed in for people who didn't have opportunities and didn't have access to the best of what there was.
It's for the future. It's something that we now need. I'm proud of the fact that we could do it. We could be part of it. I'm pleased that Alyson's name will be there and represent this place. It's been a wonderful experience.
Let each person who walks through this door, every day or one time, remember that you are a sunflower. Big, bold, bright, and beautiful.